Okay, good afternoon, guys. We're here to present a personalized scoliosis correction device. So scoliosis is the sideward curvature of the spine that affects 6 to 9 million people in the US. And it often leads to other complications like arthritis, chronic back pain, lung and heart damage. Additionally, cerebral palsy is the third most common chronic condition in children, only behind asthma and diabetes. So cerebral palsy basically is the disorder of a child's movement and muscle growth. And 64% of CP patients will develop scoliosis. So the current solution to scoliosis is a back brace that looks like this. And the problem with that is that the muscle will deteriorate due to the over-reliance on the back brace, and it's not comfortable, it restricts the movement, and many people do not wear it because it's embarrassing to wear. In fact, only 10% of children that are prescribed these back braces actually wear them. And this device costs $5,000 to $10,000 to have.
Our group focused on correcting mild scoliosis in children, similar to dental braces, which align teeth by using tension created from a regularly tightened wire. Our device aligns the spine using 2 elastic bands. Our device is personalized by using photogrammetry to 3D scan the vertebrae of each patient. Dense rubber will be 3D printed from the 3D mesh, creating the perfect mold for each case of scoliosis. For our prototype, we used a 3D mesh of the spine that we downloaded from grabcad.com. We CADed the mold on SolidWorks and 3D printed it out of TPU. In the picture above, you can see the prints of the vertebrae that we used. Our personalization process increases comfort, and as you can see in the GIF on the right, movement is not restricted by our brace. The picture on the left shows how our brace will be fitted on the back. For the purposes of our prototype, we used an already existing back brace to compress our brace to the back. This compression will ensure that the personalized mold will nicely fit on the back of the patient. The picture on the right addresses the embarrassing issue that children have of wearing back braces. Our brace is not only light and non-restricting of movement, but also not visible when a shirt is worn on top. Thank you.
How do you know that it works? Have you already done research on this new type of brace?
There's no. So I think they've answered.
So there's an existing brace called Scolio Smart. It uses the same idea of trying to straighten the spine by using exercises and a brace, and it has been proven to work. But the same issue of it looking embarrassing because it shows comes up. So ours uses a similar idea to dental braces, which is slowly pushing the spine back. And we could do those same type of exercises that the Scolio Smart brace uses, and theoretically it should work.
And these exercises can also be done using our brace because it does not restrict movement.
Have you tested this product?
No, we have not tested it yet.
Remind me, how does it correct? Or what's it doing to actually correct that curvature?
So the mold is created so it fits exactly on your spine. So if it fits really nicely and you provide tension in the vertical direction, it should straighten out your spine over time.
Yeah, but where does it anchor?
So
Because it
Anchor?
looks like you're
It wraps around to the strap on the bottom.
So we have 2 pictures of you right here. So basically, it's not just the tension that is correcting the spine, but also the compression from the brace. So there's 2 forces acting on it. And in the front, you can see that there's only 2 connections, 2 Velcro connections that maximizes mobility.
But if you look at the back, the part that has scoliosis is the part that doesn't have tension on it.
No, the tension is provided by the cords right here. So
Got it. Okay.
like this.
Okay.
Yeah,
Got
and
it.
then this device will be compressed using a brace.